So this is medicine and medical nursing, and the condition that we're going to discuss is thyrotoxicosis, which is one of the conditions that are affecting the endocrine system. So if you look at the anatomy of the thyroid gland, since we do understand to say thyrotoxicosis, condition affecting the endocrine system, specifically the thyroid glands. So according to the anatomy, so that is the structure of the thyroid glands. That looks like a butterfly there. That's a thyroid gland. So now, if you talk about the introduction, so we are saying thyrotoxicosis and hyperthyroidism are often used interchangeably, but it is important to realize that they are not the same. So these two conditions are different, but they are used interchangeably. What you need to understand is if for hyperthyroidism, there is increased levels of thyroid hormones. Then thyrotoxicosis, it can come in as a symptom or clinical manifestation of the hyperthyroidism that will present with excess thyroid hormone that will be there. So that's what you should understand there. So now, before we do talk about the condition itself, we need to understand the regulation of secretion of the hormones. Specifically, we do understand to say the endocrine system, specifically the thyroid gland, for it to release the three hormones that it releases, which is the T3, T4, and calcitonin, it has to be stimulated by the brain, and then that's when those hormones are going to be released. It comes in, there should be a feedback mechanism that should be there that will prompt or that will stimulate the release of these hormones. So what happens? How are these hormones regulated? How are they secreted? So now the thyroid gland itself, we are saying the feedback mechanism and the hypothalamus. So the thyroid gland will see if there is an increase, let's say an increase in terms of there are a lot of hormones that are in the circulation, you find that there will be a negative feedback that will come in that will stimulate the hypothalamus. When the hypothalamus is stimulated, it is going to release a hormone known as the thyrotropin releasing hormone. Thyrotropin releasing hormone then will act on the anterior pituitary glands to release the thyroid stimulating hormone. Just from the word itself, thyroid stimulating hormone. So the thyroid stimulating hormone released from the anterior pituitary gland will now go and act on the cells of the thyroid gland. That will make now the production of the thyroid hormone. And these thyroid hormones that will be produced are T3 and the T4 and also calcitonin. But in this instance, we are just focusing on T3 and the T4. So if you've seen the diagram the way it is, we've got the hypothalamus there. The hypothalamus in the brain will release a hormone known as what? Thyrotropin releasing hormone that will work on the pituitary glands. The pituitary gland releases thyroid stimulating hormone. The thyroid stimulating hormone works on the thyroid glands. Then the thyroid gland produces T3 and T4. T3 is the tridothyronine hormone and T4 is the thyroxine hormone. So these are the two hormones that are going to be produced. So in this instance where we're talking about the thyrotoxicosis, we are going to find that there are a lot of these hormones, T3 and T4 hormones in the blood or in the tissues have increased. That will lead now to what? To increase metabolic rates in the body. So now, what is going to happen if at all an individual has a lot of circulating T3 and circulating T4? So this is our main concern and this is what we'll look at. So now, before we do understand or we go to the effects, let's first talk about the function of the T3 and the T4 that is released. So you may find to say all the metabolic processes that happens in the body, they are controlled by these hormones. So you find that these metabolic rate regulation, they regulate the metabolic rates in the body. It can be increased metabolic production rates of the cells, leading to increased energy production and heat generation. You find to say the work that they have is in cases whereby you are in hypothermic state, the hormones that will come to act in play will be these T3 and T4 to make sure that uh, energy is being produced or heat is being generated. So the T3 and T4 also has the function of making sure that there is protein synthesis. So synthesizing of protein has to be there and also part of the function of these hormones. So we do understand to say the proteins are the ones that are essential for the growth and development of an individual. So hence the two hormones has to be there so that growth and development is sustained. So again, on its own, growth and development. So this plays a crucial role in growth and development, particularly during childhood and adolescent. So these hormones will play a major role in making sure that that happens. Nervous system function. So these two hormones also make sure that the nervous system is there or is being supported. So it involves the regulation of nervous system function, that is inclusion of the transmission of nerve impulses. So the nerve impulses are also going to be controlled by these two hormones that have been released. You also have to understand to say also the heart, which is the cardiovascular system. Also, the T3 and T4 hormone makes sure that it controls the cardiovascular function. So it helps the cardiovascular function, including the heart rate and cardiac output. So in a case where we've mentioned to say there are a lot of circulating, these hormones have increased in number, you find to say all these functions that we've talked about in different areas, in different systems of the body, are going to be affected. If it is in the cardiac or cardiovascular system, you find that to say the heart rate will increase, the cardiac output will also increase. Those things will come in. So those are the major role that we have to understand that T3 and T4 works or does. If we understand that, then it will be easy for us to understand the effects of thyrotoxicosis, or rather hyperthyroidism in the body. So now, the other function that this T3 T4 has, it's reproductive function. So T4 helps regulates reproductive functions, that is menstrual cycle and fertility. Muscle function, that helps regulate muscle functions, including muscle strength and tone. So in reproductive system as well, you find to say the T3 and T4 will play a role in making sure that there is regulation of the menstrual phase or menstrual cycle, the fertility of a woman, and all that. So if these hormones are imbalance, you find that also in this other reproductive function also be altered, or there may be some disruptions and causing other defects. So those are the functions. So now, going back to our condition, which is thyrotoxicosis, how can we define thyrotoxicosis? So by definition, it is a clinical syndrome. So if we mention a syndrome, we are saying a group of signs and symptoms coming up together, there are a lot of them. So thyrotoxicosis is a clinical syndrome that results when tissue are exposed to high levels of circulated thyroid hormone. So it is a condition that will arise up when the tissues of the body are exposed to high levels of circulating thyroid hormones. So the difference, like I mentioned, hyperthyroidism and thyrotoxicosis should be, for thyrotoxicosis, there is an increased exposure of the thyroid hormone, but for hyperthyroidism, there is increased production. That's why I said hyperthyroidism can be manifested in thyrotoxicosis. So that is the definition, or in other terms, you can define it as thyrotoxicosis is a hypermetabolic state caused by elevated circulating levels of free T3 and T4 hormone, that is characterized by metabolic levels resulting in increased appetite, muscle wasting, and the exophthalmos. So these all follow the second definition, which gives you all the 5 marks. So you need to understand it is a hypermetabolic state caused by elevated circulating levels of T3 and T4, which are the hormones that will be characterized by increased metabolic levels that results in increased appetite, muscle wasting, and also exophthalmos. So that should be your definition. So now, let's talk about the causes of hyperthyroidism or thyrotoxicosis. So the first commonest cause of thyrotoxicosis is Graves' disease. So Graves' disease stands as the first cause or the commonest cause. So this is a toxic diffuse goiter, an autoimmune disease in which there is overproduction of an antithyroid stimulating immunoglobulin, which has the same effect as thyroid stimulating hormone, which in turn stimulates the body to high amount of thyroid hormones. So in Graves' disease, like they've said, it is an autoimmune where the body itself will start coming up with antibodies, so that this autoimmune function will come in making sure that it resembles the function of the thyroid stimulating hormone that stimulates now the production of these thyroid hormones. So that is in Graves' disease. Then the other cause that we have is toxic nodules or toxic mouth nodules. So if you go in the structure of the goiter, the structure of the thyroid gland, you find to say it has got nodules. So these nodules, if we've got toxic nodules or mouth nodules, a lot of nodules there, they start producing a lot of thyroid hormones. So they will disturb the production of the thyroid hormone, which is T3 and T4. So in this condition, there is presence of nodules in the thyroid gland that locally produces excessive amount of thyroid hormones, which is toxic in the case refers to overproduction of thyroid hormones. Hence, there will be increased levels of T3 and T4. So Graves' disease and the toxic nodules. So this is what I'm talking about. So you've seen the normal thyroid gland, the way it is. Then here on the right side, we've got hyperplastic or inflammatory goiter. So the thyroid gland has more like become enlarged. Then the second one, we've got a single nodule goiter. So there, these nodules that I was mentioning about, these are the ones that are going to cause the production, high production of what? T3 and T4. Then we have the other one, which is multinodular goiter. You've seen a lot of them there. So these will all come together and predispose or cause the production of T3 and T4 to increase. So now we move to toxic solitary adenomas. So we are talking about tumors or cancers. So in this condition, there is increased production of thyroid hormone, which increases the levels of free thyroid hormone circulating in the body. So in case where the thyroid gland is carcinogenic, you find to say T3 and T4 hormones will be high or they'll be produced in excess. So conditions again, inflammatory condition of the thyroid gland, such as the thyroiditis, inflammation of the thyroid gland. So inflammation of the thyroid gland causes excess thyroid hormone stored to spill into the bloodstream, causing thyrotoxicosis. So that will happen if there is thyroiditis. Then we also have choriocarcinoma, causes the thyroid gland to be overactive, hence causing thyrotoxicosis. So choriocarcinoma, which is known as stroma ovary, they also predispose one to thyrotoxicosis or cause thyrotoxicosis. Then we also have follicular carcinoma, leads to increased secretion of thyroid hormone, causing thyrotoxicosis. So follicular carcinoma, the follicles that are found in the thyroid gland, if there are cancers that develop in those follicles, you will find to say someone may have thyrotoxicosis. So now, what is the clinical picture or the clinical types of thyrotoxicosis? So we've got the primary thyrotoxicosis, which is known as the Graves' disease. Like I mentioned, this one is the commonest cause. So that is the first one. Then secondary thyrotoxicosis is the one we are calling as toxic nodular goiter, in which there is increased production of T3 and T4. We also have solitary toxic nodules, and lastly, hypothyroidism due to rare causes. So these are the clinical types of thyrotoxicosis. So now we talk about the pathophysiology. So for the pathophysiology, first thing that we need to understand is we need to understand the regulation of the release of the thyroid hormones that I talked about previously or in the introduction. So For the pathophysiology, we are saying the thyroid is controlled by complex feedback mechanism. The release of thyroid stimulating hormone from the anterior pituitary gland is stimulated by low circulating levels of thyrotropin releasing hormone from the hypothalamus. When the thyroid stimulating hormone is released, it binds thyroid stimulating hormone receptors on the thyroid gland, causing the uptake of iodine, which later leads to release of thyroid hormone. So here what we're talking about is, in a case, we do understand to say the function of these thyroid hormones is to make sure that there is metabolic processes that are being maintained in the body. So if there is any feedback mechanism that is there in cases whereby we have low circulating T3 and T4, what will happen is the hypothalamus is going to produce thyrotropin releasing hormone that will act on the anterior pituitary gland, that will cause the release of thyroid stimulating hormone. Then the thyroid stimulating hormone will act on the thyroid gland to cause the release of T3 and T4, so that there is that maintenance of those hormones that are there, so that metabolic processes are being maintained. So in a case where we are calling or we are having hypothyroidism or thyrotoxicosis, you find to say the mechanism that maintains the levels of homeostasis between the amount of level that should be there in blood of T3 and T4 is going to be impaired. What is going to impair is because of the conditions that we talked about. Number one, we talked about Graves' disease, talk about thyroiditis, all those things. So you find that there will be elevated levels of hormones, that is T3, T4, and 10, and act on the hypothalamus, which then stimulates the anterior pituitary gland to decrease the synthesis of thyrotropin, releasing hormone and thyroid stimulating hormone, thereby maintaining the levels of these hormones in the circulation. So if there is a disturbance in the normal homeostatic mechanism, this can occur at the level of the hypothalamus and the pituitary gland, inducing hypersecretion of thyroid hormone, since there won't be any mechanism to stop that. So the thyroid hormone will increase the metabolic rate in all organs that we've talked about: reproductive system, the endocrine system, the nervous system, the cardiovascular system. All those will increase. So it will also cause an increase in sympathetic nervous system activity, causing fine tremors. So an individual may present with tremors. Low heat intolerance. The thyroid hormone directly stimulates the heart, increasing the heart rate and cardiac output, and also blood flow. The elevated thyroid hormone also affects proteins, lipid, carbohydrate metabolism. So the synthesis and breakdown of protein is also increased. So you find that fats will be broken down at a very faster rate. You find that that's what will lead to muscle wasting of an individual. So that's what is going to happen. So now, if you talk about the signs and symptoms, what could be there? So there is increased appetite. There is increased appetite. So, or eating due to increased metabolism. So there is increased the metabolism of carbohydrates, fats, and protein. So you find to say someone will have increased appetite. So there will be marked loss of weight due to failure match between food intake and metabolic rate. So you find that someone will lose weight a lot because of increased metabolic rate of or metabolism of the fats of the body. Then weakness and easy fatigability due to excessive use of available energy and the reserve. So all those may be manifested, and also there may be heat intolerance due to increased heat production. So heat production in thyrotoxicosis will also increase. Then there is rapid pulse ranging from 90 to 160 beats per minute, and wide pulse pressure, resulting for increased systolic and decreased diastolic pressure as well. So that will happen. So those are symptoms that will occur. So now let's talk about the mechanism leading to these symptoms. How are these symptoms coming about? So number one, we're saying there is increased metabolic rate. So elevated thyroid hormone increases the basal metabolic rate, leading to weight loss despite increase in appetite, weight intolerance due to increased thermogenesis, like we talked about. In the cardiovascular
if effect, we've got thyroid hormone will increase the heart rate and cardiac output. Tachycardia may come in. If you talk about neurological effect, there is hypothyroidism will enhance the sympathetic nervous system that will cause an increase in the body. If you talk about the heart, there will be faster heart rate and all that. Anxiety may come in, tremors, restlessness, and emotional instability. Musculoskeletal effects will be muscle weakness may occur due to muscle catabolism driven by high metabolic demand. So all those will be there as signs and symptoms, and not forgetting nervousness that will be characterized by hyper excitability, irritable behavior, and apprehension. And also, there may be diarrhea or increased defecation due to increased peristalsis and exophthalmos, producing a startle facial expression due to excessive fat collection behind the eyeball. So you find to say there will be a lot of fat that will be collected behind the eyeball, sorry, that will lead to exophthalmos, where someone will have an increased or there will be protrusion of the eyeball outside. So that is those are the signs and symptoms that may be presented. So some may be weight loss, tiredness, emotional instability, palpitations. So this is the exophthalmos. If you've seen behind the eyeball, there is collection of some fats that has made the eyeball to protrude from the outside part. There may be central nervous system sign. Again, we may have insomnia, tremors of the tongue and the outstretched hand, agitation, exaggerated reflex may also come in. Cutaneous changes, cutaneous changes of moist, warm extremities, profuse sweating, falling of hair, clubbing of fingers and toes, soft and brittle nails may come in as well. So those are the signs and symptoms. So for the investigations, as always, we start with history taking. History taking was to have history of signs and symptoms such as heart palpitation and increased appetite. Physical examination may review enlarged thyroid gland, and also exophthalmos will be seen on inspection. Blood, you can also blood for circulating thyroxine and the tridothyronine hormone, which is T3 and T4. They will be elevated. So the normal levels of T3 and T4, you have T3 should be in the ranges of 2.3 to 4.2 picograms or per millimeter. Then for T4, it should be 0.8 to 1.80 microgram per deciliter. So that's the normal ranges. So if you're doing a blood circulating for these hormones, it should be in those ranges, but they will be high. So thyroid scan may detect abnormalities of thyroid tissue, what specified abnormalities as well. So thyroid scan will also show that there is an enlarged thyroid gland. Then there's also blood serum will show a decreased thyroid stimulating hormone as well. Radioiodine uptake test may also be used where an oral dose of iodine is given to the patient after 24 hours. An assessment is then made to see how much iodine the thyroid gland has absorbed. A high uptake of iodine by the thyroid gland indicates hyperfunction of the thyroid nodule. So those are the things that will tell you or depict to say this person has thyrotoxicosis. Medical treatment will go with the medicine. So I've got a drug known as the Propacil, which is PTU. Can give 300 to 400 to 450 milligrams for TDS. The dose should be, so that is presentation, the dose should be 100 TDS. Then we also have methimazole or tapazole also can be given, and also carbimazole can be given as well. And supportive that you can give as radioactive iodine, oral propranolol. This is for the increased cardiovascular effect of function. Iodine also, and also sedatives in cases of tremors and irritability. So what remains is the necessary management, of which we have the environment, rest, activity, observation, nutrition, psychological care, hygiene, air care, elimination, IC. Then we talk about the complications. So for the complication, there will be exophthalmos. This one we said it's comes in as a result of correction of connective tissue in the ocular muscle, narrowing the surface area, hence making the eye to start bulging. Then we also have thyroid stone. So this one, it is a sudden exacerbation of symptoms of thyrotoxicosis that may be characterized by fever, sweating, tachycardia, extreme nervousness and excitability, weakness and loss of muscle tone. So that is about thyroid stone. And also dehydration may come in due to excessive sweating because of increased metabolic rate. Osteoporosis, the bones will be affected as well. So thyroid gland controls how much calcium is used by the body, and overactive gland diminishes how much calcium gets into the body tissue. So maybe reduced bone density. So since the thyroid gland is not there to control the levels of calcium that should be taken up in the body, in the bones, that will happen. So cardiac failure will also be there. So thyroid hormone will also have a profound effect on the heart function. The overactive thyroid can tax the heart and second into a heart failure. So those are the complications of thyrotoxicosis. So that is about thyrotoxicosis. Thank you very much.